Hi everyone, I'm Dr. Jonathan Torres. I'm an osteopathic family physician. I'm stuck home with my family in quarantine, as I'm sure many of you are too. And a question that a lot of my friends and family are asking are, what can I do to try and help protect my family, stay safe, and if we do get sick, try and keep it from getting really bad. So osteopathic medicine's been around since 1874. It was founded by A.T. Still. And the focus of osteopathic medicine is to improve the way the body functions so that it can be the best reflection of itself, to keep from getting sick, and if we do get sick, to recover more quickly, and if we get injured, to try and recover more quickly from injury as well. So what I'm going to cover is a couple of basic things that you can do in your home for your family and your friends who you're quarantined with to try and help protect one another, ensure you're healthy, and try and give you a tool that we can do to pass the time and hopefully come out of this on the other side healthier than we started it. So a lot of the premise that we're going to cover is focused on the lungs because that's the majority of what COVID-19 affects. And so we're going to start with treating the diaphragm. We're going to look at the rib cage. We're going to look then at some of the nerves that control the lungs, the diaphragm, from a sympathetic fight or flight perspective and from a vagal rest and digest perspective. Now keep in mind she doesn't have a fever, and so that's the first cough I've heard today. So we're going to start with the diaphragm. First I'm going to take my thumbs and I'm going to place them just underneath her rib cage so that if I push down I feel the soft squish of a belly, not the firm resistance of a rib. I'm going to do that on both sides and let my fingers fall down on the sides of her rib cage. And from here, what I'm going to do is I'm going to move her whole rib cage to the left and let it come back and to the right. And when I do that, it's harder for her rib cage to move to the right than it is for her to move to the left. So what I'm going to do is carry it to the left where it's easier to go and ask her to take 5 deep breaths. And while she takes those breaths, I'm just going to maintain that rib cage in this position. And what you'll begin to appreciate is that the ribs move more fully. You can feel that diaphragm come up and come down. And after that 5th breath, we're going to come back and we'll reassess. How does it translate to the left? How does it translate to the right? We can then repeat this with rotation. So if I turn her ribs to the left, or I turn them to the right, again, she likes the left and not the right. So we'll bring them into the east. Let's do 3 deep breaths this time. And then we'll reassess. Thanks to my young children for being cameramen at this point, and my dog for making a cameo. Next up, we're going to look at the thoracic inlet, which is a mirror of this, but from the other side, from up above the head. Now, if you do have somebody who's been coughing recently, what we can do is have them turn their head to the side so that they don't cough right in your face. We're then going to get right here, kind of on the shoulders, and we're going to do the same thing. So I'm going to push down on the right, push down on the left. She breathes, moves much easier on the right. So let me have you take 3 deep breaths again. And then we'll reassess. Good. Now, for the parasympathetic, what we're going to do is something called an OA release. The nerves that relax the muscles that go down into the airway and help thin secretions move viruses, bacteria, and other things out of the airways comes out from right below the head. So what we're going to do is I'm going to get my fingers down low, kind of right at the bottom of the hairline. I'm going to lift up to the ceiling and then lean back and basically try and just pull her head up away from the rest of her body. And I'm going to maintain that for 30 seconds. While I'm doing this, a lot of times it feels really good, so they might ask you to do it for longer than that. I'll leave that to your discretion. And what you'll begin to feel is that the resistance and how much effort you need to pull starts to subside and get less. You can also sometimes feel that one side is more restricted than the other. So for her, her left side is a little more restricted than the right. Okay, and then we can reassess, and that's more symmetric. Now the last thing that I want to cover is called rib raising. Now rib raising helps to activate some of the sympathetic nerves that go to, we're going to focus on the heart and lungs because of how coronavirus works. So what I'm going to do is come all the way underneath her body, and I'm going to feel where the bone of her spine is, her spinous processes. And from there, I'm going to come out about an inch towards me. So at this point, I'm kind of, if you can envision the part of your back that you can sink up into pretty easily. And what I'm going to do here is I'm going to lift. So you can see how her whole body comes up just a half an inch. And I'm just going to maintain that force in that area, lifting her up by that area where those nerves exit the spine, with a goal of trying to help normalize their function. Short term, your sympathetic fight or flight nervous system can cause your airways to dilate and increase blood flow to your heart, kidneys, brain, and lungs. But over long-term activations can have the opposite effect. And so what we want to do is restore the normal function of that nervous system so that it can respond minute to minute to whatever your body is facing. And again, you can maintain this for 30 seconds, 60 seconds, whatever it feels comfortable for you to do. Another trick is that it can sometimes be hard to use your fingers to lift them all the way up. So a lot of times what I'll do is I'll use my weight and drop my elbows, which will also lift them up, so there's less effort on my fingers. And now at the conclusion, we can stop here, or we can go and repeat all of those exercises again. I'd encourage you to do this at least once a day. Certainly if someone begins to be symptomatic, you could have them wear a mask or a bandana so that if they begin to cough, which is a common consequence of these treatments in patients that are actually sick, then they're not spreading all of that virus around the room and potentially infecting other people even sooner. And on that note, I'll finish this video. Thank you.